So today I'm going to be talking to you about anisometropia, which is an eye disease where basically your eyes reflect light differently, causing basically it causes like things like blindness, headaches, double vision, pain, strabismus, which is kind of like lazy eye, except for instead of your eyes shifting, it's your vision. Um, and it can cause a lot of like long lasting issues if it's not treated. I'm specifically wanting to talk to you guys about requiring screening for children in preschool because that's generally when it develops and when you are going to see it developing and getting worse or better. There are two different types of There's self-correcting, which requires no treatment, and over time your eye will fix to go back to instead of like drifting this way, it'll go back to where it is. Versus there's the other one which if you do not get some sort of like treatment or you know intervention for it, you'll basically be blind or basically have a lot of trouble seeing because one of the eyes is not strong enough to work. And this, like I said, occurs mostly in preschool kids. So screening them early would be your best choice of action in order to prevent like long-term issues with the disease. Um, in my family, my sister has this, and so does my cousin. My sister, because of where we lived, screening is required in the state where I live in North Carolina. So she was screened when she was in preschool. They caught it, and she was able to go to a doctor, which was paid for by the county, to see what type it was, how bad it was, and if there was treatments, what the treatments would be, and then they would pay for those treatments. Versus my cousin, he lived in a different state, and his was not caught because they don't do screening there for this. It's not usually seen in anything. Like you can take a picture, it's like a special picture you take, and you can see the flash off your eyes. And usually one will be stronger than the other, and that's an indication that you have this disease. And they didn't screen him, so he wasn't caught. It developed, and now he is blind in one eye and has trouble seeing in the other because it was not caught in time. So making that screening mandatory would have prevented my cousin Shane from going blind, and it prevented my sister from having any long-term issues because she got the care she needed because it was caught. And you could be saying, well, it costs money. It doesn't cost any money. These screenings are done by the county. It's two people and like a camera that use flash, and that flash will show you like the picture of the eye and show you if there's issues. The county also paid for my sister to go and it pays for most counties that do this where I live. It's paid for by them, so you're not having to worry about spending any money or on the screening or the treatment or getting the consult for possibly being diagnosed with this at all. Another thing you might be thinking is, hey, what if my kid has the kind that's self-correcting? Why would we need to know about it or have these screenings to figure it out? Well, that's because not most versions, but most people with this disorder, they have the non-self-correcting type. My sister was lucky and she had that. Most people are not. Most people need the treatment, which is basically you cover an eye with a bandage. There's a picture here, this kid right here. He's showing you what the what the treatment is, which is basically you take the stronger eye and it gets covered with the band-aid. And then the other eye, which strengthens this eye and makes it so it can correct itself before it gets too bad. In some cases, like if it gets really, really bad, even with treatment, they're going to do surgery. The problem is, uh, surgery is something they don't want to do. It's very, very risky and very, very dangerous. It can cause more issues like blindness and things like that because they're trying to fix an issue that like is very because it affects the corneas and like the very probably the most what am I thinking? What's the word? Delicate, the most delicate part of the eye. So the best thing that you can do is to try and treat it early and then avoid that surgery because most surgeons, I was doing research on this, and according to Cleveland Clinic, most surgeons won't do that surgery. They will do everything else but that surgery because of how dangerous it is. They also said that it is very likely that if you have it, like you as a person, then your child will also have it because there is a genetic link between parents and children both having this disease. Um, this is so screening early for the parent would A, get it so that they can get it fixed, and B, it would give the parent an idea because if they're screened as a kid and they know they have it, they could let if they have a child, their child's doctor know, hey, I have this, could you screen for this? Or else just make it, it would A, this early screening would cause other generations to get more screening, and B, it would prevent a lot of eye issues that like, 'cause some people don't, most people don't know they have it because it's not something that's regularly screened for, and and usually when it is caught, it's too late, and goes from anisometropia to something else. It can also cause like trouble seeing far, trouble seeing close, and it can cause both. Those are myopia, hyperopia, and then there's another one that I currently don't remember the name of. Um, but it can cause those issues as well. And also, according to, I believe it is UMMC, which is University of Massachusetts Medical Center, or Mississippi, I don't remember which country it is, but there is a chance you are born with this disease, but generally develops around preschool age. So that's the best time to be getting it checked is when you're in preschool or like maybe even early kindergarten, first grade, because that's when you're going to see the eyes changing and developing. And if I remember correctly, according to it was I don't remember who said this. I'll have to put it up to me, but um, between the ages of I believe it's 8 and 9. Those are like the final ages where you can start treating it because eventually your eyes stop developing and it gets too late. You can't treat it. So the earlier we do this screening, the better off the child. If a child, the children who do have it are in terms of getting it fixed and not having long-term issues. As you can see right here, this is what it looks like whenever you take the picture for the screening. You can see that the eye that has this right here, this like shiny, that's the good eye. This is the bad eye. So this is the eye that would be covered with the bandage like this kid has down here to fix this one. And then these are in this right here, this is the percentage of people with this disorder and like how they figure it out. And as you can see, the more within your first year of like the first couple years of life, as you're seeing the doctor more, you can see the increase in likelihood of having it. And then this one down here this shows you basically what's happening. So this one, it's kind of hard to see because the picture is small. But there we go. Oops. It's double vision. So this is the eye that is not working. This is the one that is. And so because of their difference, it's causing this double vision, which can be prevented if we get the screening done early enough. So that's why I think we should mandate screening children for anisotropia in preschool across the entire country, because without it, it can cause blindness, which is evidenced by my sister, who where I live in North Carolina, it is mandated, so we were able to catch it and fix it before it caused any long-term issues. Versus for my cousin who lives in a different state, it's not mandated, and he is now blind. So in order to prevent blindness, it should be mandated across all states to have this screening because it's not invasive. You don't have to pay for it generally for the treatment or for the screening or for getting or for going to the doctor to get that diagnosis. So there aren't any drawbacks and there aren't any like financial concerns either. And it would greatly help with preventing easily preventable issues for the children in the future if we don't screen for it.